Well, we're so glad that you came tonight to the diabetes class. I am Cheryl Bachman, one of the diabetes educators here at the Longmont Clinic. And at the next class, you're going to be meeting our other diabetes educator, who will be the nurse. So we're very happy that you're here tonight. The focus of tonight's class is going to be
we went to two classes, and one was mainly based, to understand what your body's doing when you have diabetes and what you need to do to eat better and cook better. And the second one was on exercise and how to actually keep your A1C down. And having just been diagnosed, it was very much an adventure because I had brought home all the paperwork after the diagnosis and everything, but there was no specifics, there were no directions, there were no, any kind of they don't give you a manual for living with diabetes, but the class did. I mean, the class had a lot of really good suggestions, even to the point where they told you, how we passed around menus to figure out what things would be best to eat in a restaurant. We did a number of kind of scenarios so that it wasn't just on paper, it became alive.
It's interesting that every time I teach a class and I talk with my patients, I say if there's one thing they can take away from our classes is to understand their targets for not only their blood sugar, but their blood pressure and the blood fats, which is the cholesterol and lipids. If they know their targets and where they need to be, then they can talk with their healthcare professionals, their physician, their healthcare team, and talk intellectually with them about how they can achieve their target ranges. And this truly prevents diabetes complications, the things that they don't want to acquire, the heart disease, the eye disease, the kidney disease, etc.
Excellent class. Prior to the class, I was not looking at the labels on food for carbohydrates. I was always checking for fat, but not the carbs. When I first attended the class, my A1C was at 9.9. Then I started reading the labels and used the information I learned in the class on carb counting to control my intake. In a little over 3 months, I was down to 6.8, and now after 9 months, I'm down to 5.7.
The Diabetes Care Team is a team made up of doctors, nurses, medical assistants, and dietitians that help to provide support and education for patients with diabetes.
A network of health professionals that help us teach. Everyone sees a nurse and a dietitian for their initial assessment, and if they go through our group program, then they get exposed to our exercise physiologists, our counselors, through our social services department. We take a tour of the gym.
Diabetes educators who are dietitians, but also nurses, along with our staff of 3 endocrinologists. So we're able to provide very tight management of the patients who come to the clinic.
Ideally, the role for the nurse care coordinator in patient education starts after a patient has taken the initial diabetic education classes, because in that class they will learn the basic tools that they need, the core knowledge, if you will, that they need for being able to manage their condition.
Classes are very affordable. A vial of insulin costs $125. Classes cost less than $375. It's a valuable investment for their health. If patients keep their diabetes under good control, their overall medical costs over time are reduced. The Diabetes Care Team program was originally envisioned as an educational service to help those patients with diabetes that were already receiving excellent care from physicians here at the Longmont Clinic. Over time, the educational service was opened up to physicians outside the clinic but within town. And over the last 10 to 12 years, we've actually developed an open referral policy where any physician within the Front Range can refer their patients for education through the Diabetes Care Team on referral.
If you're diabetic, you have to plan, you have to have structure to your day, you have to have structure to your meals, and you have to remember that even if it's hard to take that time to either eat right or take your blood, or make sure you get some time to yourself to exercise, or at least do something where you're not sitting in a chair. That those things are yours, and you can hold on to them once you learn what they are. And honestly, take yourself seriously and care enough about yourself to say, what you told me I have to do, I will do. I can't recommend it enough as a place to start. And especially if it's bothering you a lot, it's depressing you at all, it's something you feel it's too big and overwhelming to deal with, you've got to start someplace, and the people who teach these classes and do this work will be your greatest help, and they'll make it a lot easier.